Good health is the major basis of the existence of a human being. But for every person, good health is enjoyed when physical, emotional, physiological, social, and economic factors are positively balanced to enable the stable status of physical and mental health well-being. Achieving such a balance can be difficult, but the factors leading to ill health are different in the different parts of the world and are in different points of life. Access to comprehensive healthcare services is important for promoting and maintaining a good health. According to the World Economic Forum, Africa bears 1/4 of the global disease burden, yet has only 2% of the world's doctors. Recent research report cites underfunding and shortage of health professionals and deteriorating infrastructure as contributions to the decline in the quality of public health services. Located in a very far and hard-to-reach area of Tchetsa, in the area of Senior Chief Sultan Tambala in Dedza, there is this infrastructure which has brought a ray of hope to so many people living here, courtesy of intervention under World Vision Tchetsa area program. The nearest health center from this area is located at a distance of a minimum of 25 kilometers, and that is Mayani in the district. The main district hospital from this area, which is Dedza District Hospital, is located at around 90 kilometers away with a cruel and difficult terrain. World Vision District Programs Manager for Dedza and Salima Chikumbuto Kamwendo says with the help of community members from Tchetsa area program with funding from World Vision Korea, decided to embark on this ambitious project of constructing their own health dispensary to enable them access basic and primary health care services nearby.
The challenges were so numerous to do with seeking medical attention, but now with the construction of this hospital, children as well as their mothers and fathers are able to receive medical treatment closer to their communities. So the most prevalent health problems here, especially that are to do with child health, malaria, which is so prevalent, and IRIs. With malaria, they're able to receive drugs here at Tchetsa Dispensary, so they don't have to walk long distances just to seek medical attention.
Although it is not within the mandate of World Vision to build infrastructure such as school blocks and health centers, Tchetsa's situation in Dedza needed drastic measures taken and address a very critical need to the whole community for the benefit of the well-being of the children in the area. World Vision Malawi Director of Programs Charles Chimombo says through its maternal, newborn and child health program, the organization ensures that children and mothers are well nourished, are protected from preventable diseases, and have access to essential health services.
So we are helping communities to be able to prevent diseases before they happen. The issue of clinical medicine or treatment is not necessarily our focus, because we think that the government can take that role. But for us, we are helping communities to empower themselves, to be able to take clean water, to be able to take good food, and make sure that they prevent diseases before they occur. But in that particular case, that is a special consideration from our funding or our donors, because we realize that even if our mandate is not on clinical medicine, but the challenges that the people were facing in that area, were beyond imagination. The nearest health center is very far away in Mayani, and another one very far away in Chagunda, which is in Salima. And if a child got sick, to be able to go to Mayani or to Chagunda was almost a non-starter. So we tried to negotiate with our donors until they appreciated our need, and then that hospital was built.
Mama Delia Tawani from Mikanga village, whose household is almost 300 meters from the Tchetsa Dispensary, tells she's now able to access health services on time, unlike in the past when people were losing their lives on their way to access basic medical services to the far distant health centers. Since the dispensary was handed over to communities in October 2022, there has been a significant increase in the number of children and women accessing under 5 clinics and maternal services. Here, at under 5 clinic services such as vaccinations, weight monitoring, and health education to women and children are being provided.
In the past, when we were doing some maybe community assessment or some awarenesses maybe about diseases, preventable infections or diseases, people were asking us, why are you telling us to go to the hospital within 24 hours? We are unable to answer them the truth because the facility was just very far. As you know, from here to Mayani, it's about 25 kilometers. And now we have brought the facility just close to their doorstep. And now people are able to access health facilities at a closer distance.
According to Mai Piri, a senior medical assistant at Tchetsa Dispensary, evidence has it that under 5 clinics offer an important window through which to examine how communities are responding to the influx of health services.
People used to spend a lot of money for them to access health care. So it's a distance from here to Mayani or Lojipanya Health Center. So if the mother child is sick, the family members have to have money for the transport and to pay medical bills. So transport, it's almost 8,000 one way, that is. So times 216 plus the money to pay medical bill, almost 20. So now there is a relief. They can use that money to support their physical need.
Prince Mandivuda is a senior health surveillance assistant who came to this area some 5 years ago.
In terms of assisting all the people around here at Tchetsa Hospital.
Mandivuda says he has witnessed the change in how members of community here approach health issues, and many of them are taking their children to this dispensary, unlike in the past when it was practically impossible to carry their children to far distant health centers. Through its interventions on water, sanitation and hygiene, the area program has engaged an extra gear here at Tchetsa Dispensary, aiming at reducing the prevalence of diarrhea among under 5 children by constructing and rehabilitating boreholes and water-piped systems and sanitary facilities.
Some of the transformational projects that we're implementing in the area are water, sanitation and hygiene project. WASH, for instance, at this very clinic, you have observed that apart from constructing the clinic itself, we also constructed latrines. We also constructed a water system that is solar fed, and we reticulated a borehole. So that water is feeding staff houses as well as the dispensary itself. So we have done the same in the communities around. We have drilled boreholes, we have rehabilitated boreholes, we have also installed water systems especially in areas, as you have seen, this area is it's hilly, so it means the water table is far, so it's very difficult to drill boreholes closer to the community. So we have had to install water systems that feed communities with tap water.
Director of Programs at the World Vision Malawi believes their work with families, communities and local partners is improving the well-being of vulnerable children in the most important aspects of their lives. He adds that the organization's efforts are not only aimed at addressing basic needs, but also go beyond those to include the spiritual, psychological, and relational aspects of thriving in a vibrant and empowered community.
For this hospital to be effective, it will mostly depend on how much support is also coming from the government. We need to have very good medical personnel here, which I'm happy. We have medical personnel and nurses that are here, but we also need to have a very steady and continuous, consistent supply of drugs, especially antimalarials. We need to make sure that there is no month where antimalarials are not available. But also community members, including the chiefs around this facility, they need to ensure that they are utilizing this facility as much as possible. We should not have cases where our children are dying at home of malaria when they can get treated here. This is a maternity facility. We should not have cases where mothers are delivering at home and or maybe having all sorts of complications from the mother. We have this facility which we can use, and I think it is very important that we can use it to the maximum.
World Vision's nearly 2,500 programs are designed to address children's urgent needs and to ensure that children's well-being is sustained for the long term. The organization is working to empower communities, families, and children themselves to tackle the root causes of poverty and build a better future together.